what is the big problem with the monopolar or the complications of the monopolar electrosurgical unit? Now the complications of monopolar. The first and the most common complication is a remote burn. What is a remote burn? Remote burn is like, suppose a patient is wearing a metal chain. Yeah, you have a patient and patient is wearing a metal chain. Yeah, there's a locket and there's a chain, and suppose you forget to remove this. Even though you have put the patient plate, the current is traveling along the surface and there will be a full thickness burn along this metal part. So remote burn is a problem. Second, on the patient table, if the patient's body part is in touch with the metal surface, again it will be serving as a conductor of electricity, and again that will result in a remote burn. If you forget the patient plate, then also it will. So remote burn is a classical complication of this. The second is, when we talk about, we also have a phenomena of channeling. What is channeling? And this is very important. This is burn due to passage via narrow surface. Passage via narrow surface. Now, where do you classically see this? We classically see this in case of scrotum and penis. Now, try to understand. Suppose you are, let us take an example of scrotum and penis. So, this is the penis. Imagine this is the penis. Yeah. And you are doing a circumcision. Yeah. And you are doing a circumcision and you are using this monopolar electrosurgical unit. So you are using this monopolar electrosurgical unit, and do you know what is going to happen? The moment you press the button, the current has to travel. The current has to travel here. The problem is the current has to travel at the narrow exit of the root of the penis. So do you know, in case of monopolar, when the current has to exit via narrow orifice. This is the same concept that we utilize over the, you can say, the surgeon's electrode. The surgeon's electrode is narrow. There will be steric hindrance. And since there is steric hindrance, there will be heat, and this heat is going to cause a trouble, and this is going to cause a burn. And this is very, 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 very important point. Very important. So this is channeling. The third is during laparoscopic surgeries, or this is seen rarely in the open surgeries because the instruments are small. One thing is conductive coupling. What is conductive coupling? Conductive coupling is burn due to contact of metal surface of instrument with other organs. So try to understand. Suppose you are doing a laparoscopic surgery. So this is very common with the laparoscopic surgery. Suppose this is the port through which you are doing a laparoscopic surgery, and you are not seeing this. There is a bowel which is in contact with this instrument, this port, and this is your hook. Or imagine you are using a metal instrument. This metal instrument, this is in contact. So this is the metal piece. Which is in contact with the port, and via port, the charge or the current will be transmitted to the bowel, and this will be resulting in what? Yes, this will be resulting in a burn. So always remember, your instrument should be well out, and once it is out, you should be seeing that the metal part is not touching anything. The fourth is insulation failure. Now this is again a complication seen in laparoscopic surgery. Insulation failure. Imagine your sheath, the insulation. If you see a laparoscopic instrument, this is the inner sheath, and then it is attached to an insulation sheath. Yes, it is attached to an insulation sheath, and then this is attached with a handle. Now sometimes, suppose if this sheath part is broken, if this metallic sheath part is damaged. So if it is damaged, and whenever you are using this, there could be a catastrophe. Why? Because the charge will be conducted at this point, and yes, there could be a catastrophe. So insulation failure, yes, burn due to contact of metal sheath with bowel with the bowel or organ at site of insulation breakdown. Therefore, whenever you are operating on a patient, you should always see well in advance whether you are using the instrument, whether you are using has a proper insulation barrier or no.